So this is the Interagency Coordinating Council for Children and Youth. This group is defined in statute. It's for children to oversee the system of care for children 0 to 21 who, due to their mental health challenges, require services from multiple programs and systems, and who can be successfully diverted from inappropriate institutional placement. So everything this council does and everything we're talking about today is focused on that population of children. We're the group that oversees that system of care, and it's based on those system of care values of being family-driven, youth-guided, based in the community, and culturally competent, responsive. We're responsible for making sure all this is done in the most fiscally responsible manner possible, and that things are being tied to clinical and functionally appropriate outcomes. And I'm not going to read every slide to you, but just to hit the highlights. And then you can see some of the outcomes that are listed in statute. These are our specific duties. We're supposed to serve as an advisory capacity and provide the leadership for all these things to happen, to meet twice a year, then to designate necessary staff to help carry out the things that we need to do, and we'll talk more about that. Work to develop MAP teams statewide, which are making a plan teams, and those are supposed to be the single point of entry for children and youth about to be placed in out-of-home care, so the children who are covered by this statute. And then we're supposed to monitor the performance of those local MAP teams. So these are, again, the duties of the ICCCY, and they're pulled from the statute. So this is just continuing them, that we can provide feedback to one another and to this work groups of this structure about how each agency, the types of things they're doing, policy requirements and funding streams. And then we are supposed to be working on creating an available pool of annual funds, and then entering into binding memoranda of understanding. Now, we're not to that point yet because we just got going again, but hopefully like within the next year, we'll be instituting those MOUs. So this is in statute, and that statute is referenced at the beginning, as is because sometimes it's easier to look things up in the original bill as opposed to in the code. That's in hyperlinked at the beginning of your slides. And you can see this is just directly from the statute, what it says we are supposed to be doing. And one thing we're supposed to do is create the Interagency System of Care Council, which is typically, all these abbreviations are really flattering, the ICCCY, and then we have the ISOC, but it's created to serve as a state management team for this group. And they are supposed to collect and analyze data and look at funding strategies, really do the work of the vision that we set out, and to make recommendations to this group. And they have the responsibility for coordinating the local MAP teams and also the A teams. And the A teams, we're just giving you the bird's eye view of things today, are basically the same type of local interagency group, but through the juvenile justice system and the youth court system. These are the people that are supposed to be on this Interagency System of Care Council membership. And at the end of this meeting, we're going to ask y'all to report out. And you had this, those of you who are members, you've been given information about this, for you to report out in your system, where are you on your plans of appointing people to this system, to the Interagency System of Care Council, the work group for the ICCCY. And you can see this is pulled directly from the statute. In some instances, like with the Department of Mental Health, Department of Education, there's specific people that you're asked to appoint. That's true with Families as Allies too. Other groups like the AG's office, rehab, it's more just appointing someone. And so that's one thing we'll be asking you to share at the end of this meeting. And one thing that you'll notice in this, this was before Child Protection Services became its own agency. So I think we are safe in the parts of this that talk about DHS that apply to CPS, that it would go through CPS. But that's something that we may, as we look at, are any changes on down the road needed to this law, that's probably something that needs to be updated. So these are just some brief discussion points about the Interagency System of Care Coordinating Council. So one thing to look at is just going forward, and we'll touch base on this again at the end, but if anybody on the panel has any feedback about this, coming this year, we just kind of got the icky going again and worked on getting those 2 meetings done and updating all of you on what we're supposed to be doing. But looking at 2022, do we want to come up with a plan for both when we meet the 2 times a year? And then what would that mean for that Interagency System of Care Coordinating Council? So I just threw some suggestions out the legislative calendar and different things that happen. And we'll throw this out to y'all for discussion, a brief discussion. Would it make sense to look at our group, the ICCCY meeting in April and November of each year? The day that people picked that the most people could attend was Tuesdays at 10:30. And if those are looking good, do we want to do some sort of poll to look at those 2 months and the Tuesdays in them? And as far as the initial meeting date for the Interagency System of Care Coordinating Council, those people that we appoint, would it make sense then to try to get them to meet in January and March so they could be working on some of the things we come up with today by our next meeting? So that's just, I'll throw that out there for discussion, and then any initial topics for that group, including orientation, and then helping them have guidance in coordinating those MAP teams. So any thoughts at this point about any of those? And we'll touch base on this at the end again, but. Okay. So at the end of this meeting, we'll ask you who are with state agencies to report out on your progress of naming members to this particular council. So then at the local level, the statute also goes over that there are these local interagency coordinating care MAP teams or A teams, and they're supposed to facilitate the development of the individualized system of care programs for the population targeted in this statute. So that same group of children, and they are supposed to serve as the single point of entry and re-entry to ensure that comprehensive diagnosis and assessment occurs. So if there's a child out there that's coming to the attention of the system who hasn't been diagnosed and hasn't been identified, that the MAP teams help make that happen, and that they coordinate the services that children need who are, in this population at risk for coming out of the home. And local children in crisis shall have first priority for access to MAP teams. And that means any child who comes to the attention of the system, they may not even be receiving mental health services yet. So those of you in other systems, just thinking about those crisis situations that you deal with, and I guess Child Protection Services especially comes to mind, but I think it's true of all systems. Just knowing that there are these MAP teams that are out there that are meant to serve as the single point of entry for these children, and to support their families in keeping them in the community and in their homes. The MAP teams are the one part of all of this that have been consistently functioning from the time this legislation, it was first passed in 2001 and then updated and reauthorized in 2010. They have continually met. They have continued to meet. They've done a great job. But there hasn't always been the support from all of the systems at the table with them, because they've basically been out there beating the bushes at the local level to get people to the table. And this goes over who's supposed to be on the MAP teams. And it's basically, for purposes of this group, someone from each of the state systems that's represented at the local level. Now that can look different for different systems, but what can be done from your system that you represent to help get that system represented at the local level? And I know some of the people, I know Drew Snyder and Dr. Dobbs, and also Dr. Wright, we had a chance to get some input beforehand of what they're thinking. But we are going to ask for you at the end of the meeting to report out. Well, let me do this. This is just explaining those A teams, which are a parallel team in that are going through the youth court system and that collaborate with the MAP teams at the local level. So I'm going to try to do a new share and we'll see how that goes. This is just some more information about the MAP teams. You can see they're throughout the state, and you can see when they meet. And right now, all of them are meeting virtually. So even if they go back to meeting in person, we would ask them to continue that virtual option so that if, however, you're thinking people from your system could join these MAP teams, that they could do it either in person or virtually. So that just, and we'll get this, and you have this information in a hyperlink. All of the ICCCY members already got this PowerPoint, and all of these things are hyperlinked. And then after the meeting, this will be distributed with the recording with the hyperlinks. So, and then this is, and the MAP teams are also currently collecting data. So I'm going to share that with you, not the actual data they've collected, but what the types of data they collect. It's not coming up. Let me try one more time, and then I will go on to the next thing. This is the data the MAP teams are currently collecting. So it's basically how many children, how many families they talk to each month, how many of those are from different systems, how many are not Medicaid eligible, different populations, where they were referred from, and who all participated. So that's data that would currently be available to us. So we have that. And there is also a state level MAP team. Now, it's not in statute or in standards. So there's not a current reporting process for it related to the system of care. It actually started with the state level case review team, which I think went through CPS back when it was DHS. And it focuses on children. And then it was sort of blended into this as the MAP teams got going. It is a group of basically the children's directors at the different state agencies. We're on there, a few other people that looks at children and families in partnership with those families who have not been able to be served at MAP teams, who are those children who are at risk, who are often they haven't been able to be served by a MAP team, and they may currently be in a placement, often are, and it's basically a child in crisis where maybe nobody knows what kind of services could help them, or those services don't exist. They may even be looking at out-of-state placement. So we also need to think about that group and what kind of data and information we might need from them. So these are some suggested next steps for the MAP team. And if anybody has any initial comments about this, just looking at those overviews, are there other types of data that you would think would be helpful as we start this out to get from the MAP teams, including the state level MAP team? I would just like to know more about, what's going on with the children who end up reaching that point, and what are the issues and what happens to them now, so that we can help create and strengthen the system for what they really need. And then it would also seem to be reasonable to task that Interagency System of Care Coordinating Council with drafting plans to coordinate the state level MAP team with that Interagency Interagency System of Care Coordinating Council, because it's probably a lot of the same people, and they might be a subgroup of the ISOC or whatever, but then there would be a path for them reporting back to us. So, and then again, when we get to the end of the meeting, we'll ask you to share your agency's plan for supporting your system's participation on MAP teams. Are there any thoughts about MAP teams at this point? And Rochelle Richardson will be joining us in just a minute with the AG's office. And then we are, as a council, supposed to ensure the creation and availability of an annual pool of funds from each agency, and that includes the amount to be contributed by each agency in a process for those funds. So one thing we had already talked about is, do we want to approach the legislature about any funds just to look at getting this council going, like to support the infrastructure of all of these things, particularly related to some of the funding that's come in due to COVID that's time limited, because that would be a way to build infrastructure and then hopefully have a way to sustain it after that money goes away. So at the end of the meeting, when you report out, we'll also ask you to share any funding streams that you've come up with that support the ICCCY itself or the general SOC work that your agency has identified. And again, we realize we're at the beginning of this journey, but to just keep everybody thinking along those lines. And then also in the statute, there's this process where we can give feedback to one another and to that Interagency System of Care Coordinating Council about these things. And I pulled them out on the next slide. The federal and state statutes we go by, our policy requirements, funding streams, our funding streams within each agency to identify or serve children and youth in the population defined in this section, and the implementation of the plans of the respective state agencies for comprehensive community-based multidisciplinary care and treatment and placement of these children. So really anything we're doing as an agency or an organization, because all of this, a lot of these things also apply to families as allies, not everything, but that has to do with this population of children is probably going across systems. So how can we share that information? And we are going to ask if you can share anything about that at the end, but if any of you have any thoughts now about just receptiveness to this general concept, how it might affect our MOUs, and then what types of things could we share that would help each other, because we're obviously not all going to call each other and share every thought we have every day that relates to the system of care. We'd never get anything done. But what could we actually share that might start making sure we're coordinating things across systems and that we're not bumping up against each other or replicating? And Wendy and I did do some initial discussion about this, and she shared the idea of sharing our request for proposals, both those that agencies put out there that are related to the system of care and those we respond to as agencies. And then I suggested proposed policies that have to do with this population of children before, when they're just being formed, to put them out and find out from each other, what people think and what do they see and what are some things we might be missing. So any thoughts on any of those? And you will have plenty of opportunities to keep looking at these things and discussing them. Now, this is a policy issue that's come up that is, I think, an example of something where we can provide a lot of support and leadership. It's a little bit challenging to understand. So I'm going to try to walk us through this in a way that makes sense. And it's something I've learned a lot about the past few months. And I've tried to capture that information in a way that will make sense. So one thing our council, and this is from statute, is to serve an advisory capacity and to provide state level leadership and oversight to the development of Mississippi's statewide system of care. So we have some issues right now related to wraparound, which is a care coordination approach, and Mississippi Youth Programs Around the Clock, which is commonly referred to as MyPAC, which is a set of services. And I think there's some opportunities here. So wraparound is in that same statute. So I'm just going to hit the highlights. So the Mississippi statewide system of care shall be all these things, and it shall provide for individualized service planning that uses a strengths-based wraparound process. So that is the approach, the care coordination approach that Mississippi, and it was through this council back when it was functioning in those years 2000, 2010, that said, yes, this is where the care coordination approach we're going to use for these children, and that's going to be offered to them. So keep in mind, wraparound's a process for coordinating care. Is not a service, and it's been used in Mississippi since the early 90s. It was chosen through the ICCCCY, and it's for across systems. So that means if you're coming up with some plan in your system, this is an approach that's already available to you. There's already resources for, so that we're not reinventing care coordination across every system for these children who are identified in the statute. And the state worked with the National Wraparound Implementation Center to establish the Mississippi Wraparound Institute. So we have an institute in our state that provides subject matter expertise. And it's based on strengths, family voice and choice, and incorporating a wide range of individualized formal and informal supports to create a team. And it's a promising practice at the national level. There's a lot of evidence it works. It's that's hard to assess if it's evidence-based. It looks like it is, but it's not. There's so many different ways it's implemented that's sometimes hard to assess across all of those. And this is important, all of this is important, but the Centers for Medicaid and Medicare Services, so CMS, considers wraparound a type of targeted case management. So in order to be reimbursed, it has to go by the rules of targeted case management. And initial studies indicate that wraparound is delivered with the highest level of fidelity when it's delivered through what we call care management entities, who just do wraparound rather than community mental health centers. That doesn't mean community mental health centers can't do it. It means that the two things need to be separated. And we're going to talk about that a little bit more. That means there has to, in order to work, wraparound, which is a type of targeted case management, which is supposed to be conflict-free, has to be set up so that it really is conflict-free. So there's no conflict of interest for the person serving as the wraparound coordinator. So this is kind of the ideal system. And this is in my own words from looking at a gazillion things about this and trying to bring it to a point where it would make sense. Ideally, a child in any one of our systems comes to the attention of the system, and there's some sort of process for a neutral entity to immediately start responding to that family, figure out what level of care does this child need? How intensive services do they need? Have that assessed. And then for those children who have these high needs, which are those ones who are covered by the statute, that there would be a way for them to then be offered the option of conflict-free case management for purposes of this, that would be wraparound, where somebody who has no conflict, who's not going to be any more likely to refer to one provider than another. So they ideally wouldn't be working for a organization that provides services, works with that family and says, what do you want? What would most help? Helps them put together that team, and then services are provided. Now that all happens pretty quickly because we don't want to leave children hanging, but the service coordination, the care coordination precedes the services. They're not going to a service provider and saying, I need some help. We don't really have that set up in Mississippi yet, but we do have wraparound, which is the second part that can, in order to be effective, needs to be separated from services in some way. Now, in Mississippi, it's much more common for a child to first come to the need of a service provider. So, and that just makes sense. People are like, I need some help. I'm going to go to this place I heard about, Marion Counseling, Mental Health Center, Youth Villages, Canopy. They help people and find out what they have, or maybe they've already been referred there. So it's just, and it's natural that those entities are going to tell families about their own services. And what seems to be happening, because we don't have these things separated out, is then families are being told, and you can also have this wraparound thing, but it isn't presented to them in a way where it happens first and they can see the benefits of it. So, all right, Mississippi Youth Programs Around the Clock is a set of services. So wraparound is a way of care coordination. MyPAC is a set of services. It started, again, the ICCCCY helped work on it as a Medicaid waiver to help to address the needs of children who otherwise would have been in a psychiatric residential treatment facility in early 2007. And there were a range of formal and informal services available, flexible funds, a lot of really good things. The state was given a waiver from having to have conflict-free case management at that time because there weren't a lot of different service providers. And the waiver was started through Canopy, which was Mississippi Children's Home Services at that time, and Youth Villages. And then one thing that never happened, and it may have been because this group, for whatever reason, started not meeting regularly, is as more services and supports were developed in the state, that model of not being mindful of conflict case management never got corrected. So with that project, wraparound was offered by the same organization that was providing the services. So that model just got set up. And so there was never a process to get those two things separated back out. So, and originally there was a lot of monitoring and things like that. As it changed to a state plan service, what seemed to happen is that families were then kind of offered, instead of this real individualized slate of things, a sort of set of services where they were once a week getting some sort of therapy, once a week getting case management, but not that conflict-free kind of case management, but more like someone checking and saying, how are things going with the services you already have, and then parent peer support. It was paid at a bundled rate from somewhere around the beginning at a rate of $347.74 a day. And it continued to be paid at that rate, which may be a fair rate, I don't know, but it appeared that fewer services were being offered when it became, or a more restricted range of services were being offered when it became a state plan service. Now, keep in mind that system of care statute we've been talking about requires evidence-based services. It doesn't require a specific approach like MyPAC. MyPAC in and of itself is not an evidence-based service. My guess is that the providers who currently offer it have a range of evidence-based services they could be offering it. We probably need to focus more on that. But then these are some things that, okay, these are entities that are relevant. I'm trying to go really fast. Medicaid pays for it. The Department of Mental Health certifies mental health services. They have certification standards for wraparound and have proposed standards for MyPAC. The Mississippi Wraparound Institute was established in 2014, and they provide training and coaching in wraparound and advise the state on best practices. And they work with provider and practice level teams as well. They do not have authority to impose consequences or require corrective actions. So when they see challenges with this, they don't have a way of, they don't have the authority to help make changes when they're seeing challenges with any of the systems, other than to report it to Division of Medicaid and Department of Mental Health. And then the National Wraparound Implementation Center is like the National Center of Excellence for all this. And they've worked with Mississippi since the early 2000s to get this implemented in the state. They're currently offering technical assistance on this issue that's come up about how the state could implement high fidelity wraparound more consistently, because right now it's all enmeshed with the services, with how to pull it back out. And so it can be implemented with greater fidelity and also be consistent with the CMS requirements for conflict-free case management. These are the things that happen. In May, the Division of Medicaid pulled the two things apart and said, there can be wraparound, and then individually medically necessary services can be billed separately. There was a public hearing on that, and there were a lot of concerns, especially by the providers, expressed. And there seemed to be the perception that intensive services would go away if MyPAC went away. That's not true, because if we were really doing wraparound and that all preceded services, whatever intensity of services that family and child needed, those could be developed through that wraparound team. Then there was this announcement that the rate for wraparound would be increased with medically necessary services billed separately, and it included the option for using iCourt for bundle type services. So we've gotten feedback that families don't always like people coming to their house 3 times a week. Other people say they really, that works really well for families. That option was still there. It would have just been billed differently. And then for some reason, then in September, a plan was introduced to bring back MyPAC, and that may have been due to a lot of those provider concerns. That's not really clear. And then in October, DMH put out a provider bulletin with temporary standards and temporary information about MyPAC and developing standards. And their proposed rules for that would be more permanent, should be coming out for public comment soon. So we have this situation where wraparound and MyPAC haven't really been, there's not a mechanism yet where we've seen that they're separated in a way that would allow wraparound to function and to proceed services in the way it needs to. There's just a lot of issues out there. The Mississippi, or the National Wraparound Implementation Center, is providing technical assistance to Mississippi about this issue. And they've come up with some really good suggestions, like making agencies decide either you're going to be a care management entity and offer wraparound, or you're going to do services, and then making sure the wraparound comes first. So if families, want what MyPAC's always offered, they could pick that. If they want something else, they could offer that. They could pick that. And then agencies who provide services could offer a wider range of services. So that's kind of where we are now, and I'm going over. So I'm going to just suggest that this group target or keep it on our radar, that the ICCCCY really needs to coordinate with that process of finding out more about wraparound, including that technical assistance from the national group, and see where that leads us. This is the billing for last fiscal year on MyPAC. You can see the 2 agencies that billed the most. They are statewide. They're also those original providers of MyPAC. It's a service that quite a bit's being billed for. I think it's like 24 million altogether. That every dollar of that might be exactly where it needs to go. But I think this is a starting point for us to look at. And for y'all to have more information about wraparound and some of the things that are going on, I'm going to ask Tamara Hurst to give more information on that. And I'm promoting you. And then I think Pam Dollar came on since we last introduced ourselves. Well, Dr. Hurst is coming on. Do you want to introduce yourself real quick, Pam?
No, I actually did introduce myself.
Oh, I'm sorry. Okay, I'm sorry. I didn't remember that. I guess I was too distracted. I'll just turn this over to Dr. Hurst then.
Thank you, Joy. Hello, everybody. I'm Tamara Hurst. I'm an associate professor with the University of Southern Mississippi and the principal investigator for Mississippi Wraparound Institute. I also sit on the Mississippi Human Trafficking Council, so a lot of this overlaps. Joy, would you mind, can I share my screen? Am I able to do that?
I'm gonna.
I've never been promoted through Zoom before. This is pretty exciting.
Okay. I made you the host. See, does that let you? Okay, yeah, you can. All right.
Okay, so I will just say that wraparound, it can be very complicated. So I'm going to try to keep this as simple as possible and try not to use very many acronyms. Basically, I wanted to, and Joy has gone over this, but it's important to understand the history of why we have wraparound in this state. I joined Southern Miss in 2013, about a year after the demonstration waiver ended. Prior to that, we were known as the Mississippi Wraparound Initiative. We became the actual institute in 2014. And so we were part of the demonstration program, the Community Alternatives to Psychiatric Residential Treatment Waiver. And through this, that's when MyPAC was developed to provide more home and community-based services. And we are currently funded by the Department of Mental Health. It's gone back and forth between Medicaid and mental health, but now we are housed and funded, well, not housed, but funded by mental health. That funding helps us provide the training and coaching for our providers out there to maintain our national certifications of our trainers and coaches. And we also provide information, feedback, and reports to our state partners. So our mission is it's twofold. We want to help maintain an integrated system of mental and behavioral health that is, number one, family-driven, child and youth guided, culturally and linguistically competent, and community-based, and also assist our state and our state's child-serving agencies to successfully implement and sustain the state's chosen model of wraparound programming. It's important to note that there are other wraparound programs that are out there. This particular one is facilitated through the National Wraparound Implementation Center. It has an evidence-based, whereas the other wraparound programs don't have that validity and evidence and the fidelity measures that we need. So I wanted to say we do have, and these are where the acronyms come in, and I will not try to do anybody in with acronyms, but we do have measures that can show whether we are adhering to the model. Wraparound, and forgive my language, but if we don't use fidelity to the model, it's also referred to as crap around. It just doesn't work as well. And so we do have measures that we use to show adherence to the model. One of them measures our training and how our coaches are doing with sharing the information, and how the providers are doing with intended use of the training and their actual use. And overall, our training measures, which are kept by our National Wraparound Implementation Center, we don't analyze these ourselves, just so you know. Typically, our IOTA, or the impact of training and technical assistance measures, are pretty high. So we're confident that we're sharing the information that needs to be shared with our providers, and that the providers understand the use. We also have another measure called the Wraparound Fidelity Index, and this is where we can contact our caregivers or youth to ask them their experiences with wraparound. How do they feel like the experience has been for them? The one I wanted to talk about today is the Coaching Observation Measure for Effective Teams, or the COMET. And this is what we go by to measure our wraparound facilitator skill sets and the team characteristics. So this one is an important measure for us, because this shows whether our agencies are actually doing what they are supposed to do to adhere to the wraparound model. So we know that the state is getting what they're paying for as far as reimbursing for wraparound. The COMET itself is very long. It has 46 items in it, and they measure the 4 key elements that are chosen by the National Wraparound Implementation Center, grounded in a strengths perspective, driven by underlying needs, supported by an effective team process, and of course, most importantly, determined by families. So when we're talking about wraparound, this means the family has come in. They are given choices about what is available to them, about what might help their family. They're at the table when all of this is presented. Nothing about them without them. They make some choices with safety concerns always kept in mind. And then they can move forward on what the plan is. The youth is also there at the table. So when we look at our scores, the COMET is measured as either you did it or you didn't. It's demonstrated or not demonstrated, depending on how the facilitator did. And so the total scores that I'm going to show you represent the items on COMETs that were scored as demonstrated for that facilitator. And these are our scores 2013 through 2020. As you can see from the beginning, 2013, as we were learning these processes, the scores steadily increased. 2015, when we have our highest level, this is when Mississippi Wraparound Institute and Medicaid were involved in auditing and reviewing and observing how our wraparound teams were doing. And this is when we scored at our highest level. When that auditing stopped and the oversight stopped, the scores dropped. And so we've just been straggling along there for a little while. What I want to say about these scores is we can do better. Part of the audit, which sounds scary, nobody likes to be audited or reviewed, but there's also a plan for how to improve. And we look at it holistically, the agency culture, how the facilitators are doing, and how the families are doing. And if we do not get these scores up, the state is going to continue providing crap around rather than what we absolutely need to do for our families and youth out there. So our goals and what Wraparound is trying to do, the Mississippi Wraparound Institute at this moment, is to measure and report our organizational readiness to provide wraparound, a pre-implementation plan. This has not been done in the past, where organizations can come, they can get measured on how they are doing as far as getting ready to provide wraparound. Do they have the supervisors necessary? Do they have the agency culture? Are their facilitators ready and trained? Is there a firewall or that conflict-free case management? So that's our very first goal, provide that pre-implementation phase. Once we've moved from pre-implementation, we want to make sure that those firewalls exist so we can do the conflict-free targeted case management. When families come into care, there are not persons who are biased, naturally biased toward their own agency services. And we also want to make sure that during the implementation, we're auditing to ensure that fidelity to the model. The research that Joy has mentioned shows that if you maintain fidelity to this model, which is, I need to reiterate, a care coordination process. It is not one of the services. You can use any of those services that are out there for these families. This helps the family coordinate the care, and we want to make sure they're doing that, adhering to the model that we've chosen. We also need to obtain and analyze data related to wraparound, and that means where these youth have been placed. Are we lowering our institutionalized care? Are our youth staying in the communities? Are they out of trouble, out of detention? Are they staying in school? Are they able to stay with their families? And we also want to measure caregiver empowerment. This is the sustainability piece of wraparound. Have the families learned with confidence to work throughout these systems? Typically, we've got families with more than one child, and they may need to learn how to work within these systems and advocate for themselves. So I talked very fast, gave lots of information, and this is my contact information. If anybody has more questions, or I'm happy to answer as we're going along. So that's it, Joy. I did my 10 minutes, like in 7.
Thank you. Are there any questions just about wraparound or any of the information that's been presented? Okay. Well, guess we will turn it back to you, Wendy.
Okay. The next item on the agenda is our member report outs. So we would like to have each one of our board members just give an update about anything that you've had going on or anything that you want to report on that is related to the system of care. Well, this is our opportunity to be able to share what is going on across the state and look at how we can kind of partner and work together. So we'd like to keep these updates to about 3 minutes if we can. And who would like to go first?
Wendy, I'll just throw this in there too. As you give your report out, any update you have on who you're appointing to the Interagency System of Care Council and your agency's plan or your system's plan to support the MAP teams, you can include that too.
and any organizational funding as well
Right.
that you have to support for ICCCY or the system of care efforts, or if you have any ideas related to, I know Joy mentioned earlier, we talked just very briefly about possibly a request to the legislature. So if we have any specific ideas or items of interest for that as well. So what member would like to go first?
Hey, Wendy, I can go first. We've got a quick update. So we don't really have a big update as thus far. We're working right now to kind of see how best we can use our resources for the council from the AG's office. As far as appointing people to the council, we're also working on that, but we still have some questions on what they would be expected to do and what their duties would really entail for the council as far as the AG's office goes. As you know, we're not super involved in the system of care for these children, but we do have resources that we definitely think we could bring to bear to help with the council. As far as funding goes, we didn't have anything in our annual budget appropriated by the legislature for this, but we're currently working internally to see other funding streams that we could use for this council. So that's my quick minute there.
That's great. And Stephen, I think what we can do is we can kind of send you, Joy went over some of those responsibilities that are laid out really in statute as well, but we can kind of send you and Michelle some of that information to where y'all can review it to determine who might be best.
That'd be great. Thank you, Wendy.
Absolutely.
Thank you, Joy.
And Wendy, I forgot to mention, I think Rochelle Richardson from Mississippi Department of Human Services has joined too.
Great. Okay. Would DHS like to go next? I hate to put anybody on the spot, but Stephen got it started for us.
I'll just, hi, I'm Rochelle Richardson. I'm one of the deputy executive directors of age-related programs, which means I oversee, one of the divisions I oversee is youth services. So I get to work closely with Tony Kirsch. And so I think we're kind of in the same spot the AG's office is. We're, probably looking at some more information as to what sort of commitment and schedule to best identify who needs to be on the different roles and making sure that we prioritize that. We work really closely with the MAP teams at the community level. We are seeing a real need for, pushing the idea of finding the least restrictive environment which of course is a priority for us as well, since we're responsible for, we have the responsibility and the privilege of maintaining Oakley Youth Development Center. And so making sure that the kids are there are the right kids and not, not that it's just the placement of last resort because they can't find the correct placement. So unfortunately, we did not get any specific CARES Act money or COVID-related funding in juvenile justice. We are asking the legislature in our budget for some additional money to find the adolescent offender program. And so that if we were able to obtain that, that might free up some funds to help assist with making sure that kids get services that are needed in a community-based setting. And so, but we're, happy to help and assist and support, seeking grants at the federal level that could, aid in this as well, that we would qualify for. And so I think that's kind of about where we are.
Thank you very much for that update.
This is Kay from representing MAP teams. And we've talked a lot about MAP teams. Joy, you did a wonderful job of that. And I just want to just encourage you. To me, MAP teams are amazing. The Department of Mental Health through the Division of Children and Youth, we just had a MAP team coordinators training this past week. Albertine Johnson Pickett does a wonderful job of empowering all the MAP team coordinators across the state, but I just can't say enough, praise MAP teams enough. If you have the opportunity to, in your area, to just sit in on a MAP team meeting at some point and just sort of see the magic that happens when you have people in your community all gathered around this family, trying to provide supports for that family. And one of the greatest things I feel like that MAP team really helps do is to give that family a voice, which is what we just talked about with the wraparound services, and that they can have that voice and be assured that they are the pro on their family, not the other folks around the table. But the other plus is that they can talk to all of these entities at one time instead of going to 5 different places to share with them what's going on with their family. So, you know, there's always needs in communities, and, you know, we talked about funding, you know, that's always an issue, but I don't know who first came up with MAP teams long ago, but I'm grateful that they did.
Hey, that's an excellent suggestion about attending one of the teams. I mean, one of the meetings. That's a great suggestion for all of the people on the call, even our attendees as well, not just the panelists, because they are open. So that's wonderful. And you know, Linda Stewart, our director of the Division of Children and Youth Services, does an excellent job kind of coordinating and pulling together the MAP team data. And we published some of that in our strategic plan. And I think in FY, the last fiscal year, FY21, there was about 786 kids that were served through MAP teams. In the previous year, I think it was right around 500. So in a year of COVID, where a lot of times you saw some numbers decrease, our MAP teams were one that we saw an increase in the number served, which also, though, that shows you how important they are in the services provided. Okay, who would like to go next? Great updates.
Hey, this is Todd. You know, I found this very informative and very educational for me. Unfortunately, I'll just have to kind of circle back around with Drew and report back. He didn't give me any directives to talk on, so I'll just have to report back.
We're glad you're here, so that's good. Thank you.
And likewise with the Department of Health, we'll circle back around. Our leadership team did meet last week to discuss. It was led by Dr. Dobbs, who has significant interest in the work of ICCCY, just to see how we need to engage. I think y'all know our mission has limited engagement with these children and youth, but we certainly want to be supportive in every way that we can. But I don't have any specific recommendations from Dr. Dobbs yet, but we'll circle back around. Thank you.
And we appreciate that Dr. Dobbs has an interest in it as well and is showing his support. And thank you for being here today as well. Any more updates from our members? Okay, well, I will give a brief one from the Department of Mental Health. As you know, the state has mobile crisis response teams, and we recently did a training for our insert teams on some skills and some strategies specifically related to responding to crisis involving children and youth, to kind of target that population. There's also been some training recently done with the juvenile outreach programs with those therapists. And it was actually done by the National Center for Youth Opportunities and Justice. And they came and they were able to train on mental health issues and some strategies for our kids in juvenile justice, because we know that it goes across the board with all of our systems. And we're going to begin rolling some of that training out in January as well. We also have a training coming up, and I know I'm highlighting several trainings here, but for those of you on the call, and if you can please share the information to UMMC, and I know Dr. Meredith's on the call, UMMC and USM they're doing a training on November 18th for us, and it's for childcare workers, pediatricians, mental health professionals, And it's focusing on mental health awareness and specifically looking at children ages 0 to 5. So it's that early intervention. We have some information on our website and Facebook page too, and can share that with you, but it's November 18th from 9 to 12. So I think that that's a training that could go across the board for a lot of our different people who are on the call today. Looking at some of the COVID funding that we had to submit proposals for on a very quick turnaround months ago, back kind of early in March. Two areas that we're focusing on with that is the first episode psychosis, which is a requirement with the federal block grant. 10% has to be set aside for first episode psychosis. So in Mississippi, that's our Navigate program, which is an evidence-based practice, and it is for ages 15 to 30 who experience their first episode of psychosis. So this funding is going to actually add 2 additional Navigate teams to the state. So we're excited about that. We already have programs through Life Help, Hines Behavioral Health, Warren Yazoo, Region 8. I may be forgetting one other off the top of my head, but we're going to be adding 2 more Navigate teams, which is we're excited about that. And then also looking at some intensive community support services. Region 7 community counseling has intensive community support services for children and youth, but through this additional funding that the state's receiving, we're going to be able to add 8 more specialists for children and adolescents in other areas of the state. So an RFP was issued, and that's a service that can be coordinated, and it goes across systems such as your local school district, child protective services, youth court. It's got crisis response components and substance use as well. So that's something we're very excited about. And thank you, Linda Stewart. She just messaged me. I left out Region 7 and Region 4 for Navigate. So that's the other 2. It takes a team over here. But we're really excited about that, and just some, we're very excited also about being able to use some of our funding to help ICCCCY as well, and to kind of get this going back again, and then also looking at some requests to the legislature. So we're very, very interested in your feedback and anything you have to share related to that as well, because I think we've talked about this, I know, in a lot of different meetings that we've all been in. Depending on what our agency does, we're a lot of the time serving the same children. And there's so much overlap, and that's where we really do need this coordination of the system to be able to work together to better serve the families and the children of our state. So that's our update. Do you have any more? And let's see, we've kind of talked about our appointments. So as far as with our agency, with our appointments, that's listed. So we would have Linda Stewart, who's our Director of Division of Children and Youth Services, Dr. Mallory Malkin, who's our she's our Chief Clinical Officer for Behavioral Health Services. So that's on the mental health and substance use side. And Dr. Kristen Merritt would be our representative for the IDD side as well. Okay, any more reports out from our members before I turn it back over to Joy for our next steps?
I can give our report in a minute, but there's people on here who are on the panel who are ICCCCY members who aren't with an agency, and Nikki, Dr. Meredith, Pam, if you have any just general feedback about the meeting or anything that was discussed or things that you hope to see as these things happen, we'd like to give you all that chance. And then I think I may be the only one left to do the other report.
Absolutely, Joy. Thank you for saying that. It's member report outs are not just for the agencies, it's for all of the members. Yes.
This is Pam. I don't have anything to report at this time.
And Nikki or Dr. Meredith, do y'all have any feedback or just anything you want to share? I'll give just a second. Then I'll go.
This is Philip. I don't have anything specific to share on behalf of Mississippi Psychiatric Association, but several of y'all on the call, including you, Joey, and Wendy, and folks at Medicaid, are aware of the CHAMP team that I work with at UMC, Child Access to Mental Health and Psychiatry. It's Mississippi's version of a pediatric mental health care access program. We are in the third year of our grant, have a little less than 2 years left on the grant funding, and are actively searching for ways to make our program sustainable after September 30th, 2023. And we'll keep y'all posted on the progress of that. And if anyone has any ideas about funds that might flow from DMH or any other, or DOH, or any other state agency or federal source of funds, we would appreciate if you get in touch with us at the CHAMP team through me. Thanks.
Well, I'll go ahead and go and give our update. And then if anyone else thinks of something they want to add, just feel free to go right after that. So for Families as Allies, as far as our support of the Interagency System Care Council, now I haven't told this person this yet, and he's actually in another meeting for me right now, so y'all will know before him. Our appointment to the Interagency System of Care Council will be Henry Moore, which I think will be great because he's a MAP team coordinator and he serves on the state level MAP team, and I think he can help assist in bringing those things, a lot of those things together, and also making sure families are at the table. And to support MAP teams, what we want to propose to do is Karina Price, who's a family partner with us and already works with a number of the MAP teams, for her to be able to partner with the MAP teams. And since they all have a virtual option at this point, to attend them at least virtually and get more input about what's going on with them, what kind of involvement they already have from families, what kind of involvement they're working on, what the opportunities are there. And coupled with that, we, as we've been looking at all this, we've looked at how we can be more oriented towards a systemic care approach. I mean, that's what our whole organization is founded on, but we, can always self-reflect on improving. So one thing we've been looking at is in all of our proposals, looking at how can we support the MAP teams, how can we support parent-to-parent peer support, all of those things. And we do have the opportunities with a couple of our new funding sources to support parent-peer support in the youth court system and also in the healthcare system. So as Karina works with the MAP teams and Henry works with the ISOC, to be able to bring that to the table and to make sure everybody out there knows that we have those opportunities, and just bringing all those things together. We don't have any specific funds to bring to the table because we are kind of a scrappy little nonprofit. We will definitely help with any proposals or anything like that. But we have kind of allocated some of our funding. And I think I told you this last time that now through the end of March, we have all of our staff can devote at least 30% of their time to working on getting all these things going. So like with Karina and Henry doing those things, they'll really be able to invest some time in it. And I can invest time in helping, the ICCCY reconstitute and providing added support and all those kinds of things. And no one from the Department of Education was able to be here today. Dr. Wright couldn't attend, and then Nathan Oakley, who is typically the person who is representing her, he has gone on to a different job, but I did get their input, and they, the people that are supposed to be on the ISOC, they are good with that. And then what we talked about with MAP teams is if they could help the districts get the person who is over child find in the district to encourage them to be on the local MAP teams. I think that would really help, because a lot of children who come to the attention of MAP teams either probably need to be identified for special education services or have an IEP that's not necessarily working. So that would bring that piece together. And it would also help those people who are working in special education realize all the community resources that are available to supplement everything that's going on. So we talked about that. And those of you who know me know that I am always happy to help the directors of state agencies think about things. I did have the opportunity to talk to Dr. Dobbs and Drew Snyder before this meeting. And I'm so glad for y'all who came on behalf of them. A couple of things that we talked about just as starting ideas. One thing Dr. Dobbs brought up is that it may be that it's more people at the state office the most about the needs of children in this population, just because of the way case management is done in that agency. And I won't speak for the Department of Health, but he brought up that having that virtual option in case it looks like those are the best people to support MAP teams would be really helpful, because then they could attend virtually, but still have that input about families who are local and helping those families be a part of the MAP teams. And then one idea I ran by Drew Snyder that he was very open to, it's not with Medicaid, I don't think it's necessarily going to be someone from Medicaid who would be part of the team, although I know that would be welcome, but the managed care organizations, they're the ones who know where these children are. They know those children who get admitted places. They know all those kinds of things, and could help in letting families know about MAP teams, helping them come to MAP teams maybe before a child gets placed somewhere. If a child is somewhere like in a hospital or a psychiatric residential treatment facility, helping the family connect with the MAP team. And I know we have at least one person from a managed care organization that's on here today. I'm not going to put her on the spot, but there just looks like some real positive, that might be some possibilities. And Drew seemed good with that idea. So that's another thing we talked about. I can, if there's, and Carson Allen put the information for CHAMP in the chat. Hope y'all saw that. And Dr. Linda West, and she told me this at the beginning and I didn't get it out there quickly enough. She had to leave at 11:40. So she's here as our early childhood representative. And I know there's been discussions with some of the groups that are already working with early childhood, is they could help get the word out to their members to help get early childhood represented on all the MAP teams, and also make sure families know that they can come to the MAP teams if they have a young child who's starting to experience challenges. So we are to the end of our agenda, and I haven't seen anybody put in the chat if they want to do public comments. You can still do that if you would like to. And I'll just quickly go through the next steps. I'm going to make since we've gone a little bit over on some of the sections, and I know I was probably the one who mostly did that. And also we have people on here who I think are in a position where they probably need to get a bit more information from their agency. I'm just going to suggest some things as we go through these next steps. And if y'all, you can let me know if those next steps are on target. As far as targeting a date for the first Interagency System of Care Coordinating Council meeting and initial tasks, what has happened thus far with this, since Wendy and I have primarily been the ones working on bringing this group back together, we're not trying to take over anything, but just to help facilitate things. It sounds like our organization and the Department of Mental Health have a pretty good idea on their members for the Interagency System of Care Coordinating Council. I think it would be, if the group's okay with this, we could go ahead and start bringing that together, get with you all who said that you need a little more support and consultation with your agency to identify members, and maybe work towards working with you on that and aiming for an initial meeting of that group, say by late January. And that group, the first task being things like their orientation to their group and the statute, and then starting to look at how they can support MAP teams. Does that sound like, does that sound okay to just go in that direction? Or is there anybody think that's not going to work? Is that okay with you, Wendy?
Yes, I think that's good.
Okay, all right. And then we can get, if we will get the map team data out to you that's currently available, like some of the things Wendy was referencing. And I think then it might give people ideas on other data that they might like. And we can look at data any indicated additional data collection from the map teams. I do think this is issue, and I know we gave you a lot of information, but coordinating wraparound in MyPAC and what should happen next is really, really important. And I think we're at risk, even though we don't mean to be, if there is so much information, our emphasis on MyPAC and not stopping to look at how do we get wraparound, which is the part that's in statute, set up so that it can actually function the way it should function, and so that it's preceding services and not a part of services. So I think that issue is very important. We are getting that technical assistance from the National Wraparound Implementation Center. There is, and I don't have it in front of me, and if anybody has it, they can put it in chat. There is another meeting with them coming up. So what I would like to suggest is that we get that information, and it will be virtual, out to everyone on the ICCCY, so that if you would like to attend that meeting and get more information about what their suggestions are, because they definitely, I think there was agreement with that group that's been meeting with them that that should be coordinated with the ICCCY. We can get that information to you. And then it sounds like these other things that several of you would need more information from your agency on. So. Oh, and someone's asking, would it be possible to obtain a copy of the slides presented in this meeting? Absolutely. And what we're going to do at Families as Allies is, I think everybody knows we do blogs. The blog goes on our website, then the blogs go out from that week and newsletter on Wednesday. We're just going to turn this recording and these slides into a blog and put them out. So they'll be in our newsletter tomorrow. They'll be on our website, and they will be on Facebook too within a day or two. So, and then I still don't see any public. Let me see if anybody else. Okay, I'm not seeing, unless I missed it. I'm not seeing anyone asking about public comments. Okay, I'll ask one more time. Any public comments or anybody else on the ICCCY who wanted to share anything? Okay, and I flipped two things, Wendy, so I'll turn it back over to you as far as the plan to set the date and adjournment.
Okay, so we can certainly do it, send out a doodle poll as Joy has in the past. I did want to get some feedback. Is November and April, is that, ICCCY is supposed to meet 2 times a year. Is November and April pretty good dates for everybody? And is everyone still good with Tuesdays at 10:30? Are there any concerns about Tuesdays at 10:30 or maybe the months of November and April? Okay, no concerns from DHS.
This is Pam. I am also on the Mississippi Autism Advisory Committee, which also there's been conflict the last 2 meetings. The first meeting of this committee, I went to the Autism Advisory today. I'm switching. But if we could somehow try to avoid that conflict, that would be great. I may be the only member that this is affecting, but.
Is that the 3rd Tuesday? Or I don't know what Tuesday we're on.
Yeah, but during the meeting today, I was on that meeting for 30 minutes before I hop onto this one. I want to say I heard they're setting their meeting dates they were doing that whenever I had to log off, but I want to say I heard them mention a Monday for one of the meetings, but I mean, we typically meet on the 3rd, I think it's the 3rd Tuesday. And we don't meet every month. We meet 6 times a year. So I think they were supposed to be agreeing on those dates. I can get those dates to you guys.
Okay, or we could do the 2nd the second Tuesday of the month. If it is the third Monday, I mean, the third Tuesday, we could always look at the second Tuesday of the month. Keep the 10:30 slot.
Right.
Okay. Any concerns about sticking with November and April? Okay, not hearing any. The other thing that I wanted to mention is we do need to look at nominating a chair at our next meeting. Going back and looking at some of the past information about ICCCCY, we do need to look at that. So if you will, all of our members, if they'll spend some time thinking about nomination for a chair for our next meeting, which of course would be in April. Okay, any other comments? Joy, do you have any other comments before we adjourn? And of course, you'll get the information as Joy mentioned, and if we post it on the blog and Facebook as well. And then we'll send out a doodle poll just to confirm those dates, but we'll look at, Pam, after you send me and let me know about the autism meeting, we'll look at either the second or the third Tuesdays at 10:30 for November and April.
I can't think of anything else, and I appreciate the comments, and I appreciate all of you. I appreciate your, if you're here representing someone, please know that they are very appreciated too. And this has had such a good spirit and focus since bringing it back together. And I really want to appreciate everyone who's attending in the audience too. And we definitely want this to be a place where everyone is welcome, and especially in including families, because we need that feedback. And if you know families who might have input for this group and they're not necessarily comfortable attending and doing public comments or whatever, they can contact Nikki, they can contact Families as Allies, they can contact Mississippi Parent Training Information Center, that's who Pam is with, so that they can talk to another parent. And they could, and of course they can talk to anyone on the ICCCCY, but I just want to make sure that families know that.
Absolutely. And thank you for all the excellent presentations today. Everyone did a great job, and thank you for all of the report outs as well. We appreciate it. This is the time to be able to share that information and see how we all can work together. So thank you all, and we'll be sending you some information very soon.
Okay.
Have a
Thank you.
good rest of your day.
Thank you.
Thanks,
Thank you.
everyone.